This is Dr. Nancy Crum-Cianflone. I'm an infectious disease doctor and speaker for the MER conferences. There's lots of new updates this year for immunizations and important data to know about that we will be covering at this meeting, including the new updates of the ACIP immunization guidelines. Some of the new updates that are new this year are the fact that the influenza nasal vaccine is not going to be recommended for the 2016-2017 season. The reason of this is because of the poor efficacy of this vaccine in previous years. So this year we'd recommend the inactivated vaccine, and we'll be talking about the vaccine approaches, what vaccines are available in the United States, and we'll also talk about needle-free technology and other ways we can give the influenza vaccine to make sure there's protection. There'll be plenty of vaccines this season, and so we'll be discussing how you encourage your patients to become vaccinated. We'll be talking about vaccine-related disease resurgences. We've had an increase in measles and mumps in this country, and an update on when to give the measles, mumps vaccines, and who needs a booster as an adult, and particularly the travelers to Europe and travelers to the Philippines and other countries who might get exposed to measles are patients who we really want to make sure are vaccinated. The pneumococcal vaccines have been updated, and we will be covering which of your patients require pneumococcal vaccines. This is based on their age. It's also based on underlying immune deficiencies and other medical conditions. It's become a bit more complicated lately because there's now two pneumococcal vaccines available, the conjugate and the polysaccharide vaccines, and we'll be discussing which vaccines should be given and which timings and the approach to your patients. There's been a lot of vaccine lack of coverage in the United States, with only about 30% of people requiring pneumococcal vaccines getting them. So we're going to be talking about what is recommended in the vaccine guidelines to make sure patients are up to date on their vaccines. There has been recent information about meningococcal B and many outbreaks on college campuses. So there's new updated guidelines on meningococcal B vaccines and which groups should be vaccinated. There's been a lot of questions about what to do in the adolescent and teenage years and which vaccines for meningococcal disease we should give. We'll be providing a complete update on those recommendations as well.